So let's talk about what the impact of the fascia is. I mean, you talked about like it holds us together and it's pain and communication, but a couple things specifically. So with regard to pain, so whether it's inflamed or it's tight or whatever. So so fascia equals pain, how? Right. So, the
Okay.
restriction
Well,
and I don't mean a biology lesson. I want people to understand like
yeah.
what they're feeling, maybe fascia doing this.
Okay. So first, think of fascia as the thing that's holding your body together in terms of you've got bones, and then you have this stuff on the outside. And there's this idea of tensegrity. There's tension, and then there's integrity. And they created a new word called tensegrity, where you have fascia scaffolding. Fascia is holding the big structure together, and you need to have that be a certain amount of tension in order to have integrity in the whole body, right? And fascia is this basically kind of like saran wrap around your whole body. And if it's too tight, you can't breathe. If it's too tight, you can't move. And they say that a third of your biomechanics has to do with your fascia and the quality of your fascia. The fascia quality is what enables you to have that freedom of movement. I mean, almost, all body therapies and movement therapies, they're all about having freedom of movement, right? Effortless movement. And when people don't have that, we need to look at why. And the quality of your fascia, the quality of that connective tissue, on a cellular level is what's important in order to have that fluidity and flexibility, because fascia actually has a lot of water in it, and it has a lot of qualities that allow it to stretch by splitting itself. There are some amazing films online people can go to see how when you stretch, you literally see the fascia start off as a bundle, and then it will literally stretch like this to separate, to accommodate that. And some people genetically have a better ability to do that. And those are your very flexible dancer types, right? The people who gravitate towards yoga. And then there's the Vikings have very stiff fascia. So it's very hard for them to be bendy, very hard for that fascia to split. And, but you can influence your fascia. I mean, this is maybe why we're doing this talk. Like, you can influence not just by the movements that you do and the body therapies you get, but through your diet, through supplementation, through having this healthy cellular matrix.